Hey guys, Joe Deuce here. I am back with another episode of the CoVids, and we're going to go into episode 2 right now. This young lady is a lady who actually worked with when I was working in higher education full time, and she was a student of mine from Bell County, Kentucky. She is an awesome young lady and has taken on the task of leaving Kentucky to go to New York and fight COVID in a hospital setting there. So we'll be talking to her. Her name is Trinity Goodman, and we'll go ahead and welcome her to the show. All right, we are here with Trinity Goodman, who is a Louisville resident, correct? Louisville, Kentucky? Yeah. But for the foreseeable future is living in New York City, going straight to the front lines to battle the coronavirus during this pandemic going on. How are you doing, Trinity?
I'm tired. Really tired.
Yeah, I can only imagine. No, thank you. You said this is like your one day off for probably the next 2 weeks or so. And so, yeah, thank you for taking the time to talk to me. Let's just dive right in. I mean, you live in Louisville, you're a nurse, and you got a call, I guess, or saw something where you were able to go to New York and, take a flight. And I know there was a couple of other medical professionals who joined you on that trip, and now you're there in the thick of it. How did that all start? Like, how did this even get on your radar?
Well, I guess I was at work. I was working at Norton in the COVID unit, and I had been there for a few weeks. And I mean, Kentucky isn't seeing anywhere close to what
Right.
we think here. But there's actually a nurse from another hospital in Louisville that was in New York, and one of the girls that I work with reached out to her and was like, okay, like, how did you do this? So we found out this, the staffing company that she went through. We were like, let's do it. Like, why not? We're technically like PRN, which means as needed at our job. So we were like, we don't have any scheduled shifts. Let's see if we can get with this company. So we actually called on and off all day on Wednesday, and we never got through. So this company, you have to call into like a hotline, and they only take like 500 nurses for that day. So we called and called and called. We didn't get in. We're like, okay, maybe this isn't what we're supposed to be doing right now. Let's just think about it for a few days, talk to our families about it, maybe not be so sporadic. So we went home, talked to our families, talked to some of our friends. And they were like, no, you guys should definitely go. So they had another call on Friday. So that Friday, myself, her, and one other coworker called over like 6,000 times on 5 different phones. Very determined. And one of us finally got through. It was actually our friend's wife who was at home calling for us. So she quickly 3-wayed us in the call because it's technically not what you're supposed to do. But she 3-wayed us, and we acted like we were in the same house. And essentially all got up here together. So they told us that was on a Friday. They told us we could either be in New York on Saturday or Sunday, but we had to be in New York in 24 to 48 hours.
Wow.
So that being said, I was 2 hours away from Louisville at my boyfriend's house, and I had let him drive me there. Stupidly, I didn't have a car. So I was like, I guess I'm going to get on a plane tomorrow, and I really need to get home and find some of my items. Like, I didn't have a social security card. I had no idea where that was.
Oh, wow.
I've actually been doing this challenge. I lost my driver's license in last February. I lost it on my way to work, and I got so sick of buying IDs. I was like, I'm not going to buy one. I'm just going to see how long I can go. So I actually haven't had a driver's license since then. So over a year. So I was like, well, I have a passport. So that's what I actually used to get into bars and stuff anyway.
Wow.
Is a junkie passport. So I was like, okay, I have a passport. Now I need to find another form of identification during a pandemic when nobody's open.
Right.
So luckily I found, my grandparents found my social security card, and they were able to meet me in Lexington and do a quick exchange, as well as take my cat that lives with me. So it was like kind of a chaotic 48 hours. I didn't sleep at all.
Which was perfect preparation, I think, right?
Yeah, no, like I was going into this with a really crappy immune system, no sleep, completely exhausted. I don't think I slept for like 72 hours.
Oh my gosh. Yeah.
Jumped on a plane, found like the cheapest flight I could find, with two of my best friends, and here we are. The rest is history.
How many people were on that flight?
Oh, surprisingly, so another reason we think this was like God's plan is our flight attendant was one of our old coworkers. Like
Really?
we got on the plane and there was only, I think, 15 people on our flight, and he said that's the most he had in like over a month.
Oh my gosh. Wow.
Like a lot of the flights only had 2 people on it.
Yeah.
15. We were able to sit first class with him. But he was like, no one else is up here.
I was gonna say, did he at least upgrade you? Because if not, that would have been a jerk move.
He was like, you can sit up here with me. Like, no one else is here. We're not serving any snacks, so here's a water. But it was really cool because, you know, he worked with us for a couple of years at Norton, and then we get to see him.
Yeah. Doing the safety
and then we got
instructions.
told we were fired, so that was also.
Oh, you got fired for doing your job elsewhere.
Yeah, so basically they gave it wasn't, I guess, a termination. It was more of a resignation. They explained it as, if you don't come back, although we told you you could come, this is your resignation. Okay, thanks, bye.
Wow.
So,
so let's just break it down real quick. You called like mad people over 6,000 times the second time. That's not to qualify the first time. So the first time you tried to call, you didn't get through. You called 6,000 times a few days later. You finally got through. You had to pack up like a mad woman, have your boyfriend drive you 2 hours back to your house. You realize you didn't have a license, no ID, and social security card is misplaced. So now you also don't have anyone to watch your cat. So you throw the kitty in the car. You meet your parents or your grandparents in Lexington, trade them the cat for the social security card. Then you find a flight as cheap as you can to get to New York. You haven't slept. You have a weakened immune system, and you're like straight into the eye of the beast. Then your job calls you and says, "By the way, don't come back." And you're like, "It's fine. I'm staying here anyway for now." So, wow, that is a hectic.
Yeah, I mean, the craziest thing I've ever done.
Yeah.
And then you're like up here already stressed. Luckily we had 3 days rest, I have to say.
Well, that's good.
We were very fortunate. There were no assignments for us when we got here, so we were able to literally just rest for 3 days. I don't know if you would call it rest. We biked 20 miles around the city because I had never been to New York, and neither had my 2 friends. So never had been to New York. We're just like, let's ride bikes around Manhattan. Totally just rented bikes for a day and got to see the city before we started, which was crazy because there's no one out. So
yeah, it's abandoned right now. It's like just empty streets.
Yeah, we're staying in Times Square, and the only people you see are like maybe 5 to 10 homeless people.
Yeah.
But I mean, luckily the streets are empty, so we can bike because none of us have also ridden bikes in like 10 years. So.
So let me get this. So let me get this straight. You and your friends never been to New York City ever. Decide we're gonna go during a pandemic. We're gonna serve the community. You get there, you're exhausted. You haven't slept for 72 hours, and you're like, you know what sounds good right about now? Biking miles and miles around a strange place.
Yeah, we only wrecked once into each other.
So the streets are abandoned. There's no one on the streets except for you guys and 5 homeless people, and you wrecked into each other.
Yeah, okay. But we got to see all the spots. I mean, we went to the Statue of Liberty, the Brooklyn Bridge.
I'm starting to think you should not get a license when you get back. if you couldn't avoid the other 2 bicyclists.
And a couple of buses. There were a couple
buses. Okay.
Casualties where I saw my friends abandoning me as I was trying to take Instagram pictures, and I just blindly went into the street and almost got hit by a bus who did not hit his brakes because New Yorkers
Oh,
are
they don't do
rude
that.
and they don't hit their brakes. So almost taken out by a bus, but it was a good experience.
Yeah. Well, that is the strangest introduction to New York City I think anyone has ever had.
Yeah, and it really helped. I mean, biking 20 miles really helped me sleep.
Oh, I'm sure you were, yeah, as if you weren't already exhausted. I guess your adrenaline was probably pretty high going into the situation, so that was probably keeping you up.
Absolutely.
Yeah. Wow. And you're in Times Square now, so you're staying in like the best part of the city, even though the city is not really operational. Is
Yeah.
the big screen on? Like, are the big TVs and
Oh,
stuff still
yeah.
going? Yeah.
I don't know. Yeah. I can flip it around. I don't even know how to work this. It won't let
I
me.
don't know if you can flip it around. Yeah.
But yeah, I'm staying. I actually have to look at LeBron James out my window every morning.
Oh, sad day.
Everything is lit up. You can see all of Times Square, and everything's lit up. And there are people. It's crazy. There are photographers out every night, just like taking pictures of like the emptiness that is there.
Wow.
Yeah.
Just side note, top 3 celebrities you wish were on that billboard instead of LeBron James.
Honestly, maybe anybody else. I've been here for 22 days and all I've seen is LeBron James outside of my window, day in and day out.
How do you sleep with LeBron James staring at you?
So I'm just like, hey, bud, it's just you and I up here.
It's you and me. Oh, wow. So let's see. So you got there 22 days ago, 3 days of rest where you went on bike rides and such, saw all the good sights with no lines, no waiting. And now you're jumping in and you're working in the hospitals. How has that been going?
So our first day, actually, we have this thing where we wake up at 5:45 every morning until you have an assignment, and you just go down to see if you have an assignment. So you never really know. It's like luck of the draw every day. So finally on day 4, we get there, and they're like, everyone has assignments. Congrats, guys. It's 5:30 in the morning. You're going to go to a hospital today. Save lives. And you get the best pep talk. I mean, I don't know where they bring these people in from. They're all from Texas. They're all great at speaking. I mean, honestly, like, make you feel like you can conquer anything. So you go home with this great pep talk. People are crying. And then you get to the hospital and you're like, what the heck did I sign up for?
Yeah.
Like, everyone has COVID. First off, like, even if they don't have COVID, they have COVID. They probably got it from the ED, just waiting.
Mm-hmm.
And I got placed at a level 1 trauma center. So not only do I have COVID patients, everyone decides that it's 60 degrees in New York. It's a great time to stab and shoot everybody.
Right.
So we also are getting all these people who are being stabbed and shot to death.
Wow.
On top of all of this. So it's super chaotic. No one really ever knows what's going on. You don't get to eat. Sometimes you don't get to pee. You're just running around basically like a chicken with your head cut off all day with no orientation. Like, you don't know where any supplies are, if they have supplies. I honestly say every day I wish I had just brought supplies from my own hospital.
Yeah,
they,
so
like,
you didn't know where they are.
Yeah, they don't have basic things either. Like, yesterday I was trying to find a feeding tube that, goes into your nose and into your stomach for a patient. And they were like, this is the only one in the hospital. Good luck.
Wow.
I'm just like, wow, okay, awesome. Like, they have nothing there. So you just MacGyver things. They have no feeding pumps, so you're just MacGyvering whatever you can find to feed people. Like,
that's insane.
It's crazy. And not like, these people are the sickest people you've ever seen.
Yeah.
You're walking into like rooms like of people who are on, luckily not on my unit, but like on the med surg units, that you walk in and like it's nothing for you to find your patient dead, because we don't have enough monitors for everyone, so you don't even know how long they've been dead.
Wow.
And people that I work with, like, they are experiencing that on their units. And I mean, we don't have enough drugs to keep people asleep on the ventilator, so we're like their blood pressure, we call them pressors, like drugs that essentially keep you alive, that constrict your vessels to give you a blood pressure when you don't really have one. So we're kind of to the point where doctors are like picking and choosing who lives and who dies. Like yesterday, for instance, I had a patient that we didn't even have a ventilator for the patient. So we had to like tell the family, like, you know, we can keep them alive, but eventually they're going to need to be intubated. And we currently don't have a vent for your family members. So we're either going to, you decide to get them to a facility that has a vent, which is hard because nobody has a vent.
Mm-hmm.
And they were older. They had a lot of other issues other than, you know, COVID. But they weren't like a surgical candidate. So it was like, okay, so, or you just make them a DNI, and we let them die. So that's what we did, because she was definitely gonna die soon, like hours away from dying. So the family just kind of had to make that choice.
Yeah.
And then we have patients like, sorry, we need these drips for other patients. You know, we've given you 3 weeks to recover. You haven't. So we're going to turn these drugs off and you're going to die. And we're going to have to tell your family that this is what we're doing. And I mean, it's very like ethical and moral dilemmas every day that I did not expect to see. I mean, I expected to see more so like the ventilator, but I mean, just resources in general. We don't have resources to keep people alive, even if they are on a ventilator.
Wow.
So it's crazy.
Yeah. Do you feel like, do you feel like anything could possibly prepare you for what you've like gone into?
No. I mean, I read something the other day that was like going into these hospitals are like going to war with flip-flops and a stick. I mean, you literally have nothing. You just have to protect yourself and do the best you can. And that's hard coming like from a facility, I feel like, and having the nursing background I have, that's to really like keep people alive and to help people, and to feel like you, like, even if I try my hardest, there are days that I can't keep people alive because I just don't even have the resources to keep them alive.
Right. Yeah. Even if you had the staff and the resources, it would still be tough. So without all that, you're kind of just, you're pushing a rock uphill. So
like forever, always. Like there's always something else. Like you're like, well, I'll fix this problem, but we have this problem. And then there's also this problem. So it's fighting, you know, it's a catch-22. And there's no good answer for any of this.
Now, with all that going on, I mean, obviously, mentally, that has to be exhausting. Emotionally, that has to be exhausting. Physically, it has to be exhausting. How do you convince yourself to get up every day at 5:30 and go down and find out if you have assignments? Like, what keeps you pushing?
Honestly, I think that I had my first day off after working on day 16. And I remember sitting here, and my boyfriend's also here. He came up here with a different company as a physician. So we got to hang out, and I just like had a mental breakdown, I think, after just processing everything that I've seen. Because when you're working 16 days straight or 14 days straight, you don't have the time to even think about all of the messed up stuff that are like it's going on. So you kind of just eat, sleep. You're in like this mode where you just eat, sleep, and wake up and work. So that's kind of how I was in this routine, and I never really had the time to stop and think. I mean, I barely had time to eat on most days. So the last thing I was going to do is think about all the crappy things that were going on. But after that, it was really hard. Like, I understand why the company I'm with only like makes you do 21 days.
Yeah.
Because a lot of people are like mentally and emotionally exhausted after 21 days.
Oh, yeah.
And also I understand why they make you work straight days, because if you stop for even a second to think about all of this, you're like, what the heck is actually going on?
Yeah. I mean, I can't imagine. Yeah. You were there 16 days in a row working. You didn't have time to think. You're just in the zone, basically, doing whatever you can do. But then you have that break. How do you return after that break? Like when it all catches up to you?
It was hard. Like I cried a lot that night, and I'm not I'm a crier, like a happy crier. I'm not a sad crier.
Right.
So I just remember like laying in bed thinking like, there's no way I can go back to work tomorrow. Like I didn't want to. I was like, I don't want to go back to work tomorrow. And then I texted some of the other girls that was here with me, talked to my family, and they're like, okay, you've gotten this far. Like, you know, we've all seen some really bad things, but at the end of the day, like think of all these people you're helping.
Yeah.
And although a lot of days I do feel defeated, like I'm not helping anyone because like just because you're keeping people alive does not mean you're helping them at this point. Because like what quality of life some of these people are going to have after all of this is also disturbing. So I thought about it, and I thought about the people from the actual hospital that I'm working at in the Bronx, and like they even text me, like they're the nicest people. On my day off, they text me like, "We missed you today. Like, I hope you have a great day off. Like, can't wait to see you tomorrow. Can we get you anything? Do you need anything?" And I just have such a great support system here that it was like kind of like, okay, pick yourself up. Like, you can get through this. If anyone can get through this, you can get through this. You're fine. Yeah. So then you just kind of hit the ground running again on the next day.
And just find a way to push through, huh?
Yeah, you do. Like, luckily had one of the same patients the entire time I've been here. I've built such a great relationship with her family. So it's nice. Like, they call the hospital and they ask for you specifically. Yeah. And, you know, the husband has came to visit her, and yesterday he hugged me, and he was just like, he sends us food. And he was like, I hope you're staying here longer. Like, I hope you renew your contract so you can stay here and take care of her until we get her out of here. Right. So it's like, even if I'm not making a difference in like every single person's life, at least I know for a fact that I'm making a difference in this family's life, and specifically this patient's life that I've gotten very attached to. So that kind of keeps me going, because I also don't want anyone else taking care of her. Yeah.
Don't mess up what I've done. Don't.
Literally, I'm like, the days that I am off, I'm like, you guys better give her to a good nurse. Right. Yeah. Yeah. Better look great when I get back.
Right. I mean, that's where a lot of your hard work and energy's gone to, and to see if you saw it go down the drain or, you know, disappear, that'd be crushing, wouldn't it? Yeah.
Oh, I don't know what I don't know what I will do if something happens to her while she's in this hospital if I'm not there.
Wow. Yeah. And now you renewed your contract, is that right?
Yeah, so essentially, the first contract was 21 days, and then I renewed for another 21. But after talking to my friends and family and talking to the people here, I decided to actually go for another 8 weeks. So I will be here until the end of June.
Wow. Well, I commend you on that. Yeah, because after what you've just described, I mean, being able to say, I can take it for another 60 days is a lot. That's I mean, when this is over, you will have put in what, 90 days, 3 months?
Yeah.
Yeah. Wow. Are you seeing any let up, or is it just the same, or is it getting worse? Like, what are you seeing?
It depends on what part of the city you're in. So my hospital is a level 1 trauma center in the Bronx, which is obviously getting hit with trauma as well, because it's trauma season. Like, it's the springtime, the summertime. That's a whole different beast that I'm not used to, because I didn't come from a trauma hospital. So we're seeing an increase in traumas as the weather gets better. But I think right now in other parts of the city, it's slowing down as far as COVID goes. So we're taking a lot of the COVID transfers, because we've slowed down in COVID and increase in traumas. We're taking some transfers from Queens. Queens is getting hit really hard right now, where they weren't getting hit as hard when we first got here. Now they're they're to the point where all their facilities are full. They're opening up, like they have the Javits Center, the tennis center, just to like kind of hold patients until we can find them actual hospital beds. So we're taking transfers from Queens currently, all their hospitals with COVID patients. So it's like, as we discharge some, we just fill those beds right back up with transfers from other facilities.
Okay. But there is a decline in some form or fashion in the COVID
Yeah,
cases
I would
right now.
say there is a decline, but I think
It's just moving.
also I can't say that it's a decline or if it's just that we have staff here now, because we are to the point where not just my company, but a lot of companies are up here bringing nurses. I know my company has thousands of nurses because they deploy us in like 500s, and they brought up a ton. So our ratios have gotten better. So we're more like ICUs, where instead of having 10 patients, you have 2 to 3 ICU patients at a time,
Okay.
maybe 4 at the most, which is a lot safer than what they were doing before we came, which was 8 to 10, which I can't even imagine, because
Yeah.
I'm used to like 2, 3 at the max. If they're really sick, like that's not safe at all. So I can't say that there's much of a decline if we're just on this like plateau and now we have enough staff, but we still don't have the resources to keep people alive. And as the city reopens that they're talking about, there's going to be another surge. So
yeah, that's the fear I think around the world really right now, is as people are starting to try to reopen things. Is that going to do more damage than good, or is it, is it going to be good for us to get back to some normalcy, even though it's never going to be the same? I don't think
no,
that's
never.
yeah. What are you hearing there? Like, as far as, are they giving you guys any kind of timeline of like, this is how long we're expecting this to go on? I know I was talking to another person who works in a COVID unit in North Carolina, and they've been told that COVID unit itself is staying input for 2 years at least. Yeah. So are you hearing anything like that, or is it just kind of?
No, but also where we're at this is like, ground zero of COVID,
Right.
at least
Yeah.
in the United States. I don't think they expect it to let up anytime soon. Every unit's a COVID unit. We have one clean unit in our hospital, and it's maybe 12 beds, and it's essentially just for traumas that come in. It's like a trauma ICU. But even then, it gets infiltrated with COVID, because if you come through the ED, I swear everyone gets, like, if you come to the ED, just expect that you're going to need to be swabbed. So here, it's like, they haven't told us that they're going to open anything yet. I think everyone expects things to start opening soon, as other states start to open. I know Kentucky is starting to open, like chiropractors and dentists.
Right.
Which I understand, like, all those things are needed. But we're going to see a surge. I mean, there are going to be more hotspots. Someone reached out to me today about coming to New York, and I was like, honestly, New York is doing well right now as far as staff goes, but other hotspots like Texas is going to be a big hotspot soon. Boston is becoming a hotspot. There's going to be more pop up all over the globe as things open up. There's no way to just stop this. We can't. It's crazy to think, though, we can't social distance forever. Like, it's just not feasible.
Yeah.
So eventually things are going to happen, and eventually this is going to spread once again like wildfire. We're going to have more hotspots.
Yeah.
It was nice to flatten the curve for a little while, but I think flattening it completely is like an expectation that we shouldn't have.
Wow. What about you and your friends? Have any of you guys gotten COVID yet, or you just think you probably have it?
I had it.
Yeah.
I think I had it before. I think I had it actually.
Before you went there?
Before, yeah, we had a lot of, instead of having flu season this year, we had a lot of pneumonia season, which is weird, in the ICU. And I actually had a patient that fit the criteria. He died before we were able to ever test him, or before this ever became a thing, but he had just moved to the country and traveled. He actually just moved to America. He just traveled with his family. He had cancer. He had other comorbidities that would have led him to getting this. He went into ARDS for literally no reason. And he had this pneumonia that he was negative for everything. We could never figure out why we couldn't get him off the ventilator. And after taking care of him, I got super, super sick in December, January-ish. I mean, I had called into work for 2 weeks. I was on the couch sleeping because I couldn't even like lay down in my bed because I couldn't breathe. I had to sleep sitting up.
Wow.
Coughing until I threw up, like stuff like that. And I never, ever, ever get sick. So I think I had it. I did get exposed at work before I came, and I was negative. But as they're doing like antibody testing, I want to get tested and see if I had it, because I was negative for flu, strep, everything. I had been negative for everything, but I just like could not shake whatever I had for 2 weeks.
Yeah. Wow.
So I think I had it.
Yeah. Just by the time they tested you, it was gone. So
Yeah. So.
wow. Yeah. Well, yeah. I saw a statistic the other day that basically said that there's so many people in this country that have had it, but they don't know. They just thought it was something else. They laid up on a couch for 2 weeks or what have you, or they, or they're asymptomatic, and we'll never know that they had it. So yeah, that's it's so crazy that something can move through our population, and half of us don't know that it ever happened to any of us, and then the other half are literally on their deathbeds or at death's door. Wow. What is obviously you're coming from Kentucky going up there. What do you feel like the feeling is amongst like the local nurses? Are they, I mean, obviously they're grateful to have you guys. You said they text you earlier. What is the morale like otherwise though?
Luckily I've had where I've worked, they're just so grateful for us. I know other people have had bad experiences where, as I forget, we're in New York and people are rude or very blunt. And they don't know how to take the nurses here. But they've been so nice. They've protested a lot though. I know that they're getting hit pretty hard. At our hospital, they just protested because I guess beforehand they didn't have to have doctor's notes until they had missed 3 shifts. And now the hospital is trying to say they need to have a doctor's notes before missing any shifts. And I can't imagine doing this. Like, I'm only going to have to do this for, 3 months. But they've been doing this since, December already. And they've been getting hit hard and overworked since then. I can't imagine this being my regular job. Like, I can't even fathom. Like, they're overworked. They're so tired.
Mm-hmm.
They're just, like I said, they're just exhausted. They're so happy that we're here just so they can take days off, because they're having to work overtime to even staff the hospitals. But also we've heard of nurses like not showing up and striking, and 500 nurses not showing up for a shift. Our company, the day before I got here, had to send 500 nurses out pretty much immediately because only 2 nurses in the whole hospital showed up.
Oh, wow.
So there is some pushback. Like, they are some hospital. I think it depends on where you work. Some hospitals I think are very upset that travelers are here because they can't really strike and do what they want to do because there's just someone there to take their spot if they lose their job.
Mm-hmm.
But I mean, they don't really have enough staff to really lose anyone at this point, because if they take away the travelers, there's like no way this hospital system is gonna not collapse.
Wow. I mean, obviously you're there helping. You have that opportunity. What would you say that other people could do to help this pandemic? I mean, obviously we're not all medically trained professionals. What can the average people do to help during this pandemic and make things at least better, or at least try to lessen the load that you're seeing?
Honestly, like, social distance. I mean, yes, it sucks, but like, not going out, or when things reopen, don't like go out immediately, like, and go to the bar with 50 other people and think that you're not gonna get it. Like, it's so frustrating to see people like always just like, I don't know, go off about social distancing and talk about how bad it is and how it's not working, and it doesn't matter, because it does matter. If you don't want your community to look like New York, which Kentucky hospital systems cannot handle anywhere close. Like, we just don't have the providers, we don't have the nurses, we don't have the beds, the ventilators, the resources to handle anything close to magnitude as New York. But if you know someone in healthcare, send them a text, send them a video, send them a meme, something, because we are up here, even not just in New York, but every nurse, we're all working so hard right now, just to keep people alive, everywhere. I mean, even in Kentucky, before I left, we had really sick patients that, luckily we had the resources to keep them alive. But I mean, they were sick, and after taking care of a patient like that for days, you're exhausted. So if you have any friends that are nurses or doctors, just let them know you're thinking about them. Send them a Starbucks gift card, send them a GIF, a meme, something, just to like make them laugh, because sometimes that's the only thing that gets them through the day. Send supplies if you have supplies. If you're one of those people that hoard all these supplies, send them to your local hospital, because everywhere's running out of masks.
Mm-hmm.
Everywhere's running out of hand sanitizer, gloves. And then I know of people that are like trying to sell N95s on Amazon for like $300. Like, seriously, like really, you don't need that. Let's be real.
Yeah.
You probably have never even been mask fitted to know if that one is your size. Come on now.
Yeah.
So just be nice to people. Like I said, it's hard enough to be up here and seeing all this COVID stuff, and plus we're seeing all these people wanting to shoot each other and stab each other, and I'm like, come on. Like, we have enough people dying. I really don't need you to decide it's a good idea to shoot someone today. Like, come on.
The weirdest part for me, though, is to hear that. And the shooting, I get, because you can do that from more than 6 feet away. You got to get real close to stab somebody. Like, so you're putting yourself at risk, and your whole gang, your whole crew's at risk, all the Crips, all the Bloods. Like, they're all at risk now. Yeah, that's ridiculous.
Everyone. Yeah. Like, why are you getting close enough? Why are you getting mad enough? If you were actually social distancing, why are you getting mad enough to decide it's a good idea to go stab someone? Like, seriously, bro. Like, I even said that to one of our patients who had been stabbed, and I knew that he had stabbed someone first, and I was just like, bro,
what are you doing, bro? Yeah.
We're the same age. Clearly, 2 different paths were chosen here. But like, what were you thinking? You thought that was a good idea. You really thought it's 67 degrees outside today, so I'm gonna go start a fight. Like, really? You see these people that came into the ED with you that are also dying because of COVID, and you're taking up this hospital bed because you thought this was a good idea. And
now we'll probably have COVID.
Yeah, and now you're probably gonna get COVID among all of these other things. Like, sorry about you.
Oh man, that's that's the most ridiculous thing. Yeah,
it's the craziest thing. Like, it's okay if you see a car accident. Like, people are still driving. Some people still are having to go to work, and But I'm seeing all these people shooting and stabbing each other, and I'm just, bro, really?
Yeah.
Like, this is really like, people are dying every day.
Right. Yeah.
And that's the thing here. Like, it's eerie. Like, everyone knows someone who's died from COVID. There are so many hospital workers at the hospital I'm working at, doctors, nurses, janitors, that have all died from COVID, or someone in their family has just died, and they're young, like 30 and 40 years old. Not the regular, person with comorbidities. Like, some of these people have no comorbidities, and they just get that sick.
Yeah, and I think that's one of the reasons I wanted to make sure to start to try to document some of this and talk to people, is because here in Kentucky we have pretty low numbers. It's hard to say that with over 200 people dying, but still relatively low compared to the rest of the country. But you hear people all the time who are like, this isn't a big deal. I don't know anyone who's been affected by this. And I'm like, there's literally millions of people who've been affected in some way by this so far, and we're not even at the midway point or at the peak for most places. So
it's like nothing for me to be in the break room and one of the nurses be like, well, so and so's husband died, he got COVID, like, and you're just like, oh my God. And this guy that I work with, 3 of his friends, he's in his 40s, and 3 of his friends under the age of 40 have died from COVID.
I think that's the other month. Yeah, that's the other misconception that a lot of people have is, it's only taking out old people, or it's only taking out people who have, bad immune systems. But that's not the case. Like what you're saying, there's people under 40 who are absolutely fine, get this, and because of a lack of resources or lack of supplies or just, what have you, it ravages their body, and then they're done, or they're on dialysis for the rest of their lives, or have some other lifelong illness.
And who knows? Like, some of these patients come in with COVID, and they get septic, and then your kidneys shut down. You're on dialysis. Like, this is something that is just going to change your life. Not everyone's lucky enough to be asymptomatic and be able to just go home and hydrate for a few days.
Yeah,
And a lot of people, I think, also have the misconception is only 1% or only 2% are dying or whatever they say. But like, think about 1 or 2% in the whole world. That's
Yeah.
millions and millions of people. Like, it's not just like 100 people are dying.
Right.
This is millions of people. We have thousands of people die in New York every day.
That's rough. Wow. Well, thank you very much for taking the time to talk to me. What's one thing, like if you had one message you would deliver to anybody who happens to see this, what would it be?
Oh Lord, that's hard. If you're fighting the good fight, keep fighting. I mean, if you're in nursing school, push through nursing school, because this isn't going to be the last. Hopefully it's the last pandemic, but I think this is going to change a lot of things going into healthcare, and it's going to change. It's definitely, we're not going to have a new normal after this. If you can help, find a way to help, even if it's just sending your friend a card or letting someone know you're thinking about them, buying groceries for your elderly next door neighbor so they don't have to go out to Walmart. Everyone just do good. Just be good to each other during this time, because, I mean, like I said, a lot of people are dying, and this could be the last, time you get to see a lot of people.
Yeah.
If it does hit Kentucky as hard as it's hit some other states, a lot of people are going to die. And I mean, this might be the last conversation you have with that elderly neighbor. So everyone just needs to be kind right now.
Okay. Well, thank you, Trinity. Thank you so much. I'll make sure to send you some memes so you can share them.
I need them.
Yeah, you can go to my YouTube, check out my comedy clips, pass them along to the nurses up there, make me famous in New York.
I got you. I got you.
That'll work. Thank you so much, Trinity.
Yeah, thanks.
Thank you all for tuning in. We really appreciate having you and having Trinity. Shout out to you, Trinity Goodman. You are doing awesome work. I'm very proud of all the things you are doing up there, and keep fighting the good fight. If you have somebody who has a great story or is doing something special during this pandemic, please let me know. You can hit me up in the comments section. You can also hit up my Patreon. It's patreon.com/Joe Deuce, and you'll get comedy clips on there. You'll get memes on there, and you'll also get these episodes a week before everybody else. So stay tuned. CoVids episode 2 is over, and we'll be bringing you more episodes as the weeks follow.